Ready to rock. Good afternoon, everybody. Welcome to the City of Toronto's COVID-19 media briefing for Thursday, April the 9th, 2020. With us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto's Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor?
Well, Brad, thank you and good afternoon. It's been 4 weeks now since our city took action, followed quickly by the province of Ontario, to follow the advice of public health officials and take precautions, what seemed like drastic precautions at the time, to help stop the spread of COVID-19 and save lives. Since then, we have moved to do everything we can as a city to make sure people get the help they need right now. We've also continued to follow the advice of Dr. de Villa, our Medical Officer of Health, to take further action when it comes to stopping the spread of the virus and to further protect people. All of our actions have been focused on saving lives and making sure that we get through this pandemic as quickly as possible so that the lives of the people who live in this city can return to normal as soon as possible. This is a deadly virus, and sadly it has already taken the lives of more Toronto residents than SARS did in 2003. We join the families and the friends of those who have lost loved ones taken by this virus in mourning their loss. And we thank the healthcare workers and other caregivers who are doing everything they can to save the lives of those continuing to suffer from COVID-19. We will continue to do everything we can at the city to help save lives and to help make sure people get the message that the best way to fight this virus, the best way to avoid becoming infected or spreading the infection to others, is to stay at home as much as possible. I will say it again in the hopes that even more people get the message. Please stay home whenever you can. I urge everyone who can stay home to stay home this Easter weekend. I know it's a more difficult time to stay home historically and in terms of people's habits. It's hard to be away from friends and families, and it's hard not to gather together to celebrate, but it is what needs to be done in order to save lives. I know that the measures that have been put in place have been frustrating for many people. Kids want to go and play with their friends in a park. That's natural. Parents want to go out to dinner at a restaurant or have a date or have some friends over. I'm sure many of you would love to be at a Blue Jays game or at a concert rather than staying home night after night. I myself miss going to events in the community, meeting people and celebrating with them across the city. It's how I learn in my job, and it's one of the most enjoyable parts of my job is to be able to meet people and get out to see different parts of the community. But for all of us, all of that has changed now. It's been a sudden and jarring change. I know that. And that kind of change can take its toll on our residents and in particular on their mental health. I know many people are scared right now about the virus, but it goes beyond that. They're scared about not just the virus, but about their employment situation. They're scared about their finances. They're scared about businesses they might be involved in and trying to keep them afloat. And they are perhaps, jostled by the fact that they have the kids home all the time when the kids would be better off in a more structured life that they're used to at school or in childcare. We have stressed before at this table that it is okay not to be okay. I know many people feel isolated, many people feel alone. Most people probably feel disconnected from perhaps several different things. And I know that when you add a holiday weekend to that, that could be a time when it's particularly tough if you can't get together, as we're advising that you don't, with family and friends that you might have ordinarily done. So that is why today I'm sharing with the people of the City of Toronto for them to use a mental health support strategy developed to support the well-being of Toronto's most vulnerable residents during this time, but for the benefit of all Torontonians as well. To help residents experiencing stress and anxiety due to being isolated, quarantined with a positive COVID-19 diagnosis, experiencing financial hardships, and other stresses, the city has partnered with key mental health service providers to help those who need that help right now. We are focused on supporting children and young people, seniors, frontline workers in community agencies, and several communities, including the Indigenous, Black persons with disabilities, LGBTQ2S communities. And the city has partnered with a number of leading mental health organizations to deliver this service to you, including the following: Kids Help Phone and their crisis text line, Progress Place Warm Line, Toronto Seniors Helpline, the Gerstein Crisis Centre, the Ontario Psychological Association for Frontline Workers in Community Agencies, the Caribbean African Canadian Social Services, CAFCAN, for Black residents, across boundaries for Black and Indigenous peoples, persons of color, and Native Child and Family Services for Indigenous residents. Residents can call 211 to access support and to get connected to one of 7 primary mental health service partners for direct phone support. And by direct phone support, they call it a warm transfer. For when you call, they won't just give you another number to call or tell you somebody will call you back. They will transfer you to that agency that can best help you right then and there. We consider the mental health support services for being offered today and the ones that are already in place to be essential for the well-being of the people of Toronto, and therefore these services are free, provided by the City of Toronto and with the help and assistance of these agencies. By having this kind of an integrated approach, this strategy will help the city refer people who reach out to the most appropriate mental health resources. This makes sure that the city and its partners can be agile and can be responsive to changing needs. And it builds on the support that both the federal and provincial governments have given in recent days to pledge to mental health supports for people. This emergency will take time to get through. It'll take time to recover from. We all have to take care of ourselves and each other. Dr. de Villa tells us that every day at the conclusion of her remarks. If you are feeling stressed or anxious, and many of you I'm sure are, then I encourage you to seek help. It's okay to ask for help, and there may be various places you can turn, but now you know that with this variety of services and agencies that are there to help, you can turn to 211. These are resources that are being made available to help you. And again, please don't wait, but call 211 to be connected to a mental health service provider if you feel that you need that help. This strategy and the partnership formed to implement it again demonstrate how we are stronger together and how the city is here for you and will continue to help those in need no matter what the circumstances. I want to thank, on another note, Maple Leaf Sports and Entertainment for working to produce the Team Toronto video that they released today, helping drive the stay home message. We've talked about it every day up here. Many others have talked about it, and now we have some of our favorite people from the Maple Leafs and Sports Entertainment organization to put that message across as well. And it'll remind us of some great times that we had in the city thanks to that organization, many of them cheering on our sports teams. And I want to thank the Leafs, the Jays, the Raptors, the Toronto FC and the Argos, along with Haley Wickenheiser, for coming together to give people some hope and some inspiration today, because I guarantee you when you see this message, not only will you get the stay home message, but you'll be inspired and have a sense of hope when you finish watching it. Now, our COVID-19 enforcement team is continuing its work to make sure that people are respecting the city and provincial orders around physical distancing. This continues to be an extremely important priority for people to follow if we're going to beat this virus. Bylaw and police officers will be out all weekend, Friday, Saturday, Sunday, and Monday, making sure that people know what they need to do to stop the spread of this virus and keep Torontonians healthy. Our bylaw officers spoke to almost 1,000 people yesterday alone. Parks, forestry, and recreation staff have posted more than 3,000 new no parking signs at closed parking lots and more than 1,900 new social distancing bylaw signs in the parks. But hopefully the signs are just a reminder of something you know already, which is that you have to keep your distance. Ideally, you would stay home and not visit these places at all. I understand that those bylaw officers did receive a lot of positive feedback from the public for being out in the parks working, and I want to thank the vast majority of people for continuing to follow the rules, for being kind to each other, and for being kind, as we would expect, to the enforcement officers who are out there just doing their job, and they're doing it for you and for your families and for our collective health and well-being. Now, unfortunately, we do continue to see some people participating in prohibited activities in our parks, including Sunnybrook and Sherwood Park, where there were dogs off-leash and people were gathering in groups to socialize, which is not a part of the physical distancing. Humber Bay East and High Park, where there were large numbers of park users gathering together and using the closed amenities, which are closed for a reason. And Riverdale Park, both east and west, where people were congregating and using the dog park and the baseball diamond. I don't speak about not using these things because we're trying to be hard-hearted or spoil your holiday weekend. We're doing it for, again, your health and well-being and the safety of the people of the City of Toronto. You don't know when you're in those places close to other people that somebody, including yourself, might be carrying the virus. And that's why it's important that when our medical officer of health has advised that these facilities should not be in use, that we follow that advice throughout the weekend and preferably stay home. On the issue of short-term rentals in the city during the pandemic, I've been advised that city staff, the city staff have advised me that the new regulation from the province requires that short-term rentals are only provided to individuals in need of housing during the emergency period. This will help to preserve the supply of available short-term rental accommodation for people who may need to book a unit for isolation or quarantine purposes, or for healthcare, or for frontline workers in order to keep their families safe from COVID-19 exposure. Tourist stays or recreational stays are not permitted during this emergency, and so we would seek the cooperation of all concerned in ensuring that that is the use to which these units are put and no other uses. And in order to help along with that, city licensing officers, as part of their work to enforce the provincial order on essential businesses, will respond to complaints about any short-term rental that is not being used to house individuals in need of housing during the emergency period. And again, if you have anything that you want to pass along to us in that regard, you can call 311. Please take note that a party or an event in a short-term rental unit is not an emergency. The city is working with short-term rental platforms to make sure they comply with these new regulations. Letters were sent to them yesterday to notify them of this change during the emergency period. Failure to comply may result in a charge being laid under the Emergency Management Act, with fines for violating a provincial order ranging from $750 to $100,000, including up to 1 year in jail. I know today is a tough day. They're all pretty tough these days, but there seems to be more bad news every day, whether it's the Government of Canada's projections on the pandemic, which can be jarring and scary to people, or the employment numbers, which are grim. But I want you to know that we're doing everything we can at the city as a team, whether it be through our mental health strategy that we're really rolling out in an expanded way today, whether it's through our ongoing work helped on the economic recovery, which we're taking very seriously. We had a long meeting on that today to make sure that we're ready when the time comes to take advantage and bring ourselves back to what we're accustomed to. And this is all designed to help you and your loved ones get through this. But we need your help. We need your help. On this day, as we commemorate Vimy Ridge and the sacrifices our Canadian soldiers made in that battle, it is important to remember that those brave soldiers, more than 100 years ago, were supported by the women and men on the home front, including many, many people right here in the city of Toronto. We, like them, are all in this fight against COVID-19 together, and we need to work together to defeat this virus. I know the Toronto residents are up to this fight. They're ready to do their part, even if that is just staying home. And by saying just staying home, it's not to mean that that is not extremely important. It's extremely important to stay home. And that will be making a big contribution by staying home and keeping your distance from others and watching Netflix or something like that that can amuse you over the course of a holiday weekend. Every single action you take to stay home and to distance yourself from others will be a contribution to stopping the spread of COVID-19 and saving lives and getting this nightmare over as soon as possible. So please keep doing your part and we will get through this together. Before I call on Dr. de Villa to make her report for today, I want to thank in particular, and it's probably most suitable that I should do this because it's me they have the most complaints about because I speak quickly. You're all probably used to that by now, but we have two interpreters that have been helping us to provide interpreting services for our COVID-19 press conferences since March the 16th. One interpreter is a hearing person, and the other person is a deaf individual. Sarah Sadnicki is the deaf interpreter that you see on the screen, working with hearing interpreter Vera Gowdy, and they're delivering services to you. And the way this works is that the hearing interpreter interprets the spoken English to ASL. The deaf interpreter then translates that using an appropriate measure of ASL, sign, gesture, or other communication strategies in order to convey the message to the deaf community. A deaf hearing interpreter team is often more effective than a hearing interpreter alone. And it's important for us that all Toronto residents receive these messages. And so I want to thank Sarah and Vera for their service to the city and its residents at this time and apologize to both of them for the fact that I speak quickly, notwithstanding that they've asked me not to speak so quickly for several days. The other people that I want to thank, and I know I thank you on behalf of all of us up here and all the people who support us in our work, is the media. It's not often that you'll hear an elected official thanking the media, but I think it's important because you have served as the most valuable channel through which we can communicate incredibly important messages to the people of the City of Toronto. We understand the fact that, like many people in the city, the physical manner in which you do your jobs has changed, in that you're not in this room with us, which is a very unusual way to carry out a media availability. But we appreciate the fact that you do continue to do your jobs throughout this period, and we look forward to the day, and for me especially to say this, it takes some doing. We look forward to the day when we can have another media availability, or scrum as we call it, in person with you. And I hope that you too all get some time off this weekend to spend only with the people you live with, and not doing any other form of gathering such as we've counseled everybody else to do. But thank you very much for your cooperation as well. And on that note, Dr. de Villa, it's time for your report.
Thank you, Mayor Tory. Good afternoon, everyone. And before I begin my remarks, let me echo the Mayor's note of thanks to our interpreters and to the members of the media. So as of 12:30 this afternoon, there are 1,769 cases of COVID-19 in Toronto. This includes 1,519 confirmed cases and 250 probable cases. There are 174 that are hospitalized and 76 in intensive care units. Sadly, there have been a total of 54 deaths from COVID-19 in Toronto, and I would ask that you join me in extending sincere condolences to all the family and friends of these individuals who have died from COVID-19 in our community. Yesterday was a difficult day as we learned about the devastating impact of COVID-19 in some of our worst hit long-term care homes. Sadly, a large number of residents are sick and many have died. These people are our parents, they are our grandparents, and they are our loved ones. The fatal impact of COVID-19 on our loved ones in long-term care is becoming painfully clear. Families move their loved ones into long-term care homes so that they can receive the specialized extra care that they need. And so many people have asked me how COVID-19 outbreaks can happen in our long-term care homes. This is an important question to ask, because the answers can help us better protect our loved ones in these settings. One way or another, COVID-19 gets into long-term care homes through people. This includes the people who visit long-term care homes and the people who work there. It is important to remember that COVID-19 is new, and in fact, the virus was only discovered 3 months ago. So all around the world, we are still learning how to slow this virus down and how to prevent further spread in settings like our long-term care homes. The most important way is through physical distancing. One of the first measures, and in many ways the most difficult, was stopping family and friends from visiting their loved ones in long-term care homes. This was a critical step to reducing the chance of visitors inadvertently bringing the virus into these settings, as unfortunately has happened in some of our long-term care homes. Part of our core work in public health is working with long-term care homes to ensure proper measures are in place to control outbreaks and to prevent disease spread. For COVID-19, these include initiating twice-a-day screening of residents and staff to monitor for COVID-19 symptoms and to catch new infections as early as possible, implementing physical distancing measures and canceling all group activities, enhancing cleaning, particularly for frequently touched surfaces, working with long-term care homes to make sure that personal protective equipment is used appropriately to minimize health risks, and restricting staff to only work at one facility during an outbreak to reduce the chance of spread from one facility to another. Essential workers in our long-term care homes are critical to keeping our loved ones safe. But they are at risk too, and we must also keep them safe. Our best line of defense is to slow down the spread in our community. This means staying at home as much as possible, and when you do go out, to practice physical distancing. My message to you today is simple. We still have the ability to reduce the spread of COVID-19 in our city. We have a collective responsibility to do all that we can to keep our loved ones and all those who look after them safe and healthy. In closing, I want to extend my sincere thanks to my team at Toronto Public Health, to my colleagues throughout the city, including at Toronto Paramedic Services, and all of our essential service providers throughout the city, many of whom will be working throughout this long weekend. I would like to thank all of these people for their hard work and their dedication to keeping our city safe. Please continue to stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. It's been 4 weeks since the World Health Organization declared a global pandemic in response to COVID-19. In collaboration with Toronto Public Health, we have been planning for this public health emergency since January. This emergency, as we all know, escalated very quickly. On March 13th, the city first announced the closure of facilities and the cancellation of many city programs and services. The province of Ontario declared an emergency on March 17th, and Mayor Tory declared a formal emergency in Toronto on March 23rd. Since that time, many additional measures have been implemented to help stop the spread of COVID-19 in our city. Many city essential and critical services, however, must and do continue. These include garbage recycling and organics collection, the safe supply of our drinking water, police, fire, and paramedic services, employment and social service support, TTC services, critical infrastructure and maintenance, technology services, 311 availability, facility cleaning and security, purchasing and materials management, legal services, child care services for essential workers, occupational health and safety, shelter services, senior services and long-term care, people in equity services, and many, many more. The Emergency Operations Center continues to coordinate the city's response to COVID-19 in accordance with advice and guidance from Dr. de Villa and her team. This includes ensuring each of our frontline workers, including our first responders, long-term care, and shelter staff, are properly equipped and trained to protect both themselves and the public they serve. We continue to work closely with our union and association partners to ensure that we are connected on all that the city is doing in response to COVID-19. These partnerships are critical in continuing the delivery of the exceptional services Toronto residents rely on. Both Mayor Tory and Councillor Cressy, working alongside each of our city councillors, have been incredibly supportive and responsive in helping the COVID-19 Strategic Command Team to meet our objectives. This team operates 7 days a week, responding without delay as the situation evolves, as new issues emerge, and when decisions need to be made in very short notice. I want to thank the entire Toronto Public Service for what they are doing under very trying circumstances to support their city and our residents. I also want to acknowledge and thank every resident, business owner, and everyone affected as we do our very best to stop the spread of COVID-19. We are truly all in this together. These are tough times for us all, and I continue to be inspired by the strength, resilience, and commitment of our city. The city's website continues to be updated hourly with new or revised information, and I encourage you to check back regularly at toronto.ca/COVID-19. Thank you.
Thank you, Chief. We'll go to questions now. Just a reminder, 2 questions, please. First, Lucas Meyer from News Talk 1010. Go ahead, Lucas.
Thank you very much. First to Chief Pegg, I'm just curious if in the last little bit, if we do have any update on the replacement delivery for the surgical masks.
Hi, Lucas. My update this morning was that the masks have been in fact delivered and put into inventory. Every morning, the Emergency Operations Center receives a comprehensive inventory report that then is passed along to our strategic command team, and this morning's update shows those the replacement masks in inventory. So that's great news, and like I explained yesterday, that returns us to an inventory time of approximately 6 to 8 weeks. So glad to see that.
And on this weekend, this might be for the mayor as well, but you've talked a lot about people having to stay home. It is a long weekend. Just looking out today, it's quite nice weather. Now that the bylaw has been in place for a while, are bylaw officers that are out there, are they going to be still try to be more lenient, give more warnings than actual fines, or given how much time has passed, is there going to be not necessarily a directive, but perhaps more of a focus on actually finding more people now that the bylaw has been in place for a while? And do you think it's time that if people haven't gotten the message yet, then they should be fined more?
Well, first of all, I think, as you know, Lucas, politicians, elected people don't give directions to law enforcement people. They get their directions from the heads of the law enforcement agencies. I will venture an opinion on this, however, which is that I think it is time. Now, we've been at this for a week. We've been having literally thousands of people who have been given some education or in some cases a warning. And I think it is time, given the importance of this, that it's a life or death matter, that people should be given tickets if they are at this stage not receiving the message and not engaging in the kind of behavior that we would like to see. But that's up to the law enforcement people. I still think it's possible for most people to be given a gentle nudge and perhaps moved along, but it perhaps is time to be getting a little more stringent with the application of these laws, because they're there for a reason.
Thank you. We go to Jennifer Pagliaro now from the Toronto Star. Jen, go ahead.
Hi there. For both the Mayor and Dr. de Villa, I asked this earlier. The province has now clarified that residential construction hours have been extended from 6 a.m. to 10 p.m. 7 days a week. And I just wonder what your opinion is on whether that makes sense and whether that's putting additional people at risk, given that these workers are still working in close proximity and that they are obviously returning to their families and their communities after work.
I will simply say that if the province is following through on what it said it was going to do, and I have no reason to believe they're not, that there are an awful lot of inspectors out there inspecting individual sites. And so, to me, that is the process pursuant to which you will capture those places where people are working shoulder to shoulder, as they say, and thus being in violation of the physical distancing or other aspects where there isn't adequate hygiene on site. And so, I'm just very hopeful those inspections are taking place and that we will see sites actually shut down, so that we will know that, in fact, that part of it is working. And I think that with respect to the hours, I would only hope that, as is the case with many construction projects, that if they're going to work extended hours on those kinds of projects, that it is done with some sensitivity to the people who live around. Oftentimes you can make arrangements with the contractors and the workers to do a certain kind of work in the overnight hours or the late hours that are not as intrusive on the lives of others. But with respect to the safety issue, I hope that since they brought back retired inspectors and the like to do a blitz, as it were, that will prove to see that these arrangements we've put in place for physical distancing are respected, and if not, that those sites will be closed down, as the government can do, the provincial government.
And sorry, I wasn't sure if Dr. de Villa could maybe just speak to that, and I'll ask my next question.
So I don't know that there's much more that I can add. I mean, I think the mayor has made quite clear, and I hope that I've made it quite clear as well, that our imperative here is to increase physical distancing as much as possible. And I do recognize that there are important projects, critical infrastructure type projects that perhaps warrant continuation. But the main goal here is really to increase physical distancing so that we can best protect our community from COVID-19.
And I just wonder, given the outbreaks in the long-term care homes and some of the ongoing concerns in the shelters, does it make sense to have mass testing at those facilities? And is that something that the city is taking up with the province?
So on the issue of testing, we know from the experiences in other jurisdictions that the more testing that can be done, the better the direction is, the better informed the public health measures and activities and responses can be. And we also know that long-term care settings, long-term care homes and shelters, congregate settings like these places, are exactly the kinds of places where we would like to see testing. And they are, in fact, priority areas for testing for COVID-19. So we certainly continue to speak with our provincial partners on the issue of testing, largely because testing is one of those areas that is within the provincial responsibility. We use their testing results absolutely to guide public health measures at the local level, but it is a provincial responsibility and one on which we're constantly talking with our provincial partners.
Thank you. Next, David Ryder from the Toronto Star. Go ahead, Dave.
The first one is, I'm going to ask something I did a while ago, which is we're constantly kind of looking at the numbers and trying to compare them and figure out if we're flattening the curve or what we're doing. Can you just give us a little bit of a big picture so far on how Toronto is doing as far as the number of infections, the number of deaths, the number of outbreaks?
So I think I can give a relatively high-level perspective. I think one of our challenges, as we've heard and has been well reported through the media, is that unless you get to a point where you have a lot of testing, trying to make an assessment as to what is happening in the City of Toronto, premised on the existing numbers and the case counts and the information that we have in front of us, only gives us a partial picture. I think we've also heard through many other partners and many other health authorities that we are not quite there yet in terms of the peak, and the difficulty when it comes to these outbreaks and in trying to understand where you are in the outbreak is that it's not always easy to see that you're beyond the peak or at the peak until you're beyond it. So, just to go back to the earlier question, to the extent that we can get more testing, that does help not only to inform the response, but it also helps to inform us as public health practitioners around where we believe we are on this epidemic curve and what actions we might then take.
Okay. And my second question follows on that. Yesterday, Ottawa Public Health expanded the criteria for who can be tested at the Community Assessment Centre at Brewer Arena, and they added people like grocery store employees, essential works, families of essential workers, families of healthcare workers. I'm wondering, why is it in Toronto we seem to be told testing is a provincial responsibility, but in Ottawa it seems like the public health agency there is taking sort of a more active response to try and get as many people tested as possible?
So that's an excellent question, and I don't think it's quite as simple as that. So we do know that testing is within the province's responsibility. That's no different whether we're talking about the situation in Ottawa or whether we're talking about the situation here in Toronto. And in fact, I think if there is a distinction to be made, it is that in Ottawa, the city and the local public health department has partnered with other healthcare partners in order to create different assessment centers. Our situation here is a little bit different. Our assessment centers for COVID-19 testing are part of our healthcare system, and we've left that to our healthcare partners, as that's more in their area of expertise and it's more in their area of responsibility than it is in ours. So what we do have in the City of Toronto is a very active partnership with those COVID-19 assessment centers, and we have very similar priority populations across the province. In fact, they're the exact same, I should say. The priority populations for testing are the same across the province. Ottawa has identified, as you rightfully point out, certain groups that they feel are important to be included in testing. we have that purview as well here in Toronto. So we have an arrangement with our assessment centers that those who actually warrant testing based on the public health assessment should go forward for testing, even if they're not within the priority groups as stipulated in the testing criteria by the province.
Okay, last question to Matt Bingley from Global News. Matt, go ahead.
Hi, is Chris Murray in the room?
Yes, he is. Yes, he is.
Perfect.
Just give him a moment to switch places with the chief. Go ahead, Matt.
Chris, I've just been passed some documents about part-time workers with Unit B of QP 79 who are part-time workers who have been told that their hours are going to be reduced beginning Sunday. And I'm just wondering if you can clarify how many staff members in the city this would affect, who they are, and maybe take me through just that process.
Thanks for the question, Matt. So I believe last week we had indicated that a number of our seasonal workers, ones involved in the spring session, who we typically hire to do that work, were not being hired. There was about 5,400 people involved in the spring program. The part-time workers that you're talking about reduced hours, I mean, to be completely frank, I don't have an answer for you. I'm not aware of us cutting back in part-time hours of people that are working in the manner that you described. So happy to go look into that to see what specifically is the concern and what the matter is. So.
Okay, I'll just have to follow up with you on a later date, I guess. Just to the mayor, I just have a quick question. You've spoken about mental health in the past and some of the experiences that you people that you know have dealt with. I'm just wondering, can you tell us about how your circle is helping you through all of this? I know you've been isolated for quite some time during this ordeal.
Well, first of all, in my job, and it's really not dissimilar to my two colleagues here and other people like Councillor Cressy and a whole host of others, Chris Murray and Chief Pegg, we, I guess, get a lot of support from each other because we sit in a lot of meetings, perhaps some might argue too many, but we sit in a lot of meetings discussing a lot of complicated and sometimes very, I'm trying to think of the right word, jarring issues. But I also have obviously a personal support network which is in place but just not physically in place. So thank goodness for the telephone, thank goodness for FaceTime, thank goodness for iPads and all those good things, because that helps me to stay in touch. But you know, I was saying to somebody else today in an interview that I was giving, it was actually about Dr. de Villa, I said, you know, one of the reasons you end up in these jobs is hopefully because you are able to demonstrate over time from being in leadership positions that you can stay calm and that you can deal with things as they come, and not, that doesn't mean you're not jarred, it doesn't mean you're not scared, it doesn't mean you're not you know, perplexed and frustrated, but it means you stay calm. And in my case, I try to stay that way, certainly from what I've seen. All the rest of us in this command team that Chief Pegg referred to do the same thing. But we rely on the same people, always the people that are close to us and our colleagues to support each other and to hopefully make the right decisions and do the best we can. And I just hope that for those, and I can tell you right now, I wouldn't have the slightest hesitation, I never have because I haven't had occasion to, but I wouldn't have the slightest hesitation to seek help or call 211 if I felt that I was under too much stress. And I just hope people out there take these programs that we're announcing today as an open invitation to them, because we know, I know from talking to you, I know from the emails that I read, there are people out there facing, perhaps for the first time in their life, unbelievable stress from losing a job or from being isolated for a period of time. Older people who are used to having family come and support them each and every day, who are not able to see those people. And this is very stressful, and I hope people will not hesitate, not be ashamed, but in fact will be happy to seek the help that we're offering, which can be offered by phone and can go beyond that if it has to, because that's why we're doing it, so that people will, their physical health will be maintained by physical distancing and by following all the instructions we've been given, but that their mental health as well will be kept intact through the supports we can offer or just through seeking help on their own.
Okay, thank you very much, everybody. Just for our friends in the media and the public, there will be no briefing tomorrow, Good Friday. We'll be back here on Monday, April 13th. We will, however, provide updates over the weekend with respect to case counts and numbers. Please have a safe and happy Easter, everybody. Thank you.